This is the fifth in a 5-part mini-webinar series entitled Achieving Psychotropic Medication Reduction in Long-Term Care. Lake Superior Quality Innovation Network serves to improve healthcare for Medicare beneficiaries across the healthcare continuum through a collaboration between the following quality improvement organizations: Stratus Health of Minnesota, Medistar of Wisconsin, and Empro of Michigan. After this webinar, learners will be able to define and implement a gradual dose reduction, or GDR, process. CMS defines gradual dose reduction as the stepwise tapering of a dose to determine if symptoms, conditions, or risks can be managed by a lower dose, or if the dose or medication can be discontinued. Once a resident has been selected for GDR, a systematic process must be in place to ensure safety and propriety for medication reduction. Having non-pharmacological interventions in place adds to successful GDR when addressing behavioral and psychological symptoms of dementia. The medication regimen review requires a complete overview of a resident's drug regimen by a pharmacist and physician. It's intended to improve resident care outcomes while reducing or eliminating adverse events due to poor medication management. MRR includes recognizing actual, potential, and past medication errors or adverse events. MRR assists with identification of residents receiving psychotropic medications to determine whether medical diagnoses align with the indication for use. Monitoring gradual dose reduction is the ongoing collection and analysis of information, such as observations and diagnostic test results, and comparison to baseline data in order to evaluate resident response to changes in psychotropic medication regimen, identify adverse events associated with dosage reduction, and validate success of psychotropic medication dosage reduction or discontinuation. Documentation is paramount during the GDR process to protect the resident from adverse events associated with medication changes, as well as to validate the success of dose reduction. Thorough documentation must support the clinical decision to halt the gradual dose reduction when a resident is not an appropriate candidate for reduction or discontinuation of a psychotropic medication. Engaging the interdisciplinary team to implement the GDR process can be facilitated by following the steps outlined on the Antipsychotic Reduction Resident Prioritization Tool, Parts 1 and 2. While the document title refers to antipsychotic medication reduction, its use is appropriate for reduction of all psychotropic medications. The Antipsychotic Reduction Tool allows a facility to systematically prioritize residents for potential GDR, identify behaviors associated with dementia and how they impact resident quality of life, understand manifestations of unmet needs as behavior, explore non-pharmacological measures to alleviate discomfort and minimize negative behaviors, identify residents who have experienced a previous failed GDR for reconsideration, and ultimately restore to and maintain residents at their highest practicable level of mental, physical, and psychosocial well-being. Tool highlights for the standardized GDR process include: is the psychotropic medication at the lowest starting dose? Do indications match diagnoses? And if yes, can the dose be lowered? Was a GDR attempted within the last 6 months, and was it successful? And then examination of behavioral manifestations of resident need. The Antipsychotic Reduction Tool allows a facility to prioritize residents for the potential GDR. Now that the GDR process has been established, we want to evaluate the process for failures, omissions, or unclear paths, reconvene as an interdisciplinary team to improve on areas of concern, continue to monitor for success and failure, implement revised processes, and commit as leadership to sustain the improved processes. This concludes the 5-part webinar series entitled Achieving Psychotropic Medication Reduction in Long-Term Care. Please visit www.lsqin.org for additional resources related to psychotropic medication reduction. Thank you.